or what we want to cover today. First of all, I would like to welcome all our guests who are visiting us, who are joining us for this graduation, friends of family, friends of colleagues, all what we want to cover today. First of all, I would like to welcome all our guests who are visiting us, who are joining us for this graduation, friends. Thank you, Brown. So without much ado about nothing, Brown, can you go to the next slide so that we can run through what we are hoping to accomplish in the next 2 hours? Again, I am Rami Azuine. I am the lead faculty here at the Global Health and Education Projects and leading the Public Health 360 team. I believe I know all of you, and I see a couple names that are visitors who are joining here to celebrate with their friends and their relatives. And we also want to thank our invocation speaker, Dr. Marisa Rice, who is going to introduce herself later on. So let us get it going, Brown. The next slide, introduction. So let me just walk through. Back, please. Back to the program, to the agenda. So this is what we are going to accomplish today. After my introduction and opening remarks, we're gonna have introduction of the Public Health 360 faculty and staff, and then the fellows will introduce themselves according to the last name, alphabetic order, and then we're gonna have our invocation speaker. This is the first time we're doing this, so we're excited that we have a very inspirational speaker, Dr. Rice, who is a captain with the U.S. Public Health Service and you know, a leadership member at the Health Resources and Services Administration in Rockville. Then we will go on to have our first group presentation, and that will be on climate change, health, and education program. This is a program that this group crafted from bottom, clean slate. They did everything to create this program, which I think is ready to be implemented. Then after that, we're going to have Dr. Alan Thompson, who is the mayor of the town of Riverdale Park here in Maryland. GHEP is located in his town. So he is our chief host, and he has graciously accepted to come and speak to us as well. Then after that, we're going to have group presentation, group 2, which is looking at community hubs for addressing misuse of prescribed substances. And then we're going to have closing remarks, adjournment, and a recession of music. So packed agenda. Again, I am truly, truly excited today to have each of you come to the end of this journey for the Public Health 360, and then looking forward to going to the world to make all the differences that we have been training you over these 3 months. And remember, the relationship, the partnership does not stop with your colleagues. With GHEP, it continues. We'll be here to provide references. We'll be here to share job resources. We'll be here to answer questions. We'll become colleagues, or even to, you know, do some networking, or even to raise some professional dilemma across. Next slide. So now I'm going to hand it over for brief introductions to our faculty and staff, beginning with, I think Dr. Susan is still coming. Dr. Zubi, you can go.
Hi, everyone. Good day. My name is Dr. Nzbe Eboluche. I am the Fellowship Manager or Navigator of Public Health 360 Fellowship Program. So my background is from soil and crop sciences, and I obtained my doctoral program from Morgan State University in bioenvironmental sciences. So my affiliation to public health was my exposure in environmental health during my doctoral program. So with that, I started volunteering with the GHEP, and from there I really developed deep interest. So currently, my day-to-day job, 9-to-5 job, I work as a data analyst with the Maryland Department of Health. So I'm already shifting from, doing mostly environmental work into public health and looking at minority data and how we can actually create health equity and remove disparity in our community. And welcome everyone. I'm really so excited to see most of you graduating today. I just remember vividly, as if it was yesterday, when you all started this program. So I'm so excited to see you graduate and big things you're gonna do after today's graduation. Thank you.
Next, Chidubem.
So my name is Dr. Chidubem Eboluche. I have a degree in veterinary medicine. I'm a second-year student of Masters of Public Health at Howard University. And I'm interested in helping the medical and public health field to make data-driven decisions through biostatistics and bioinformatics. Thank you.
Thank you. I'm Brown.
Hello, good morning, everyone. Good afternoon, wherever you are. So my name is Brown Magnus Olivers. I'm happy to, I am the IT coordinator at Global Health and Education Projects, and I'm happy, so excited that we're able to get this out and, looking forward to the program and the project presentation. Thank you so much.
Next slide, please, Brown. So we're going to start the introduction of the Public Health 360 Fellows. The elevator speech. If you were to meet President Biden on the elevator, how do you introduce yourself to him and make sure that he gets to know the work you're doing in the short time before he leaves with the Secret Service? So we're going to get to see how that works. Archie Perry. Unmute yourself. You are muted.
Sorry. Hi, I'm Archie Perry. I'm currently a doctoral student with public health at Capella University, residing in Central Texas, and I'm excited to be completing this course.
Fantastic. Dania?
Good morning, everyone. I'm Dania Akasab. I have a bachelor's in health sciences from Mount Royal University in Canada. My expertise is more into actual lab research, focusing in microbiology and immunology. However, I wanted to expand and learn more about how we can apply science into helping bridge inequities in underserved communities and learning more about public health. And that's why I decided to join the Public Health 360 Fellowship, and I learned so much from it.
Dries? I see Dries is just joining. Let's see. Dries, I can't.
And go to Jada.
All right, Jada.
Hi, good afternoon, everyone. My name is Jada Lamptey. I have a bachelor's in science and public health from the College of New Jersey. I'm currently pursuing my master's in public health at Liberty University in Virginia. But away from my studies, I'm actually working as a student and new professional liaison at a company called ISPOR. But I work closely with students and new professionals in the field of health economics and outcomes research. So, being that I'm close to concluding my studies at Liberty, the GHEP Public Health 360 program has served as a nice refresher of the foundational skills needed to become a novice in the field of public health. So it's great to be here today.
Juliana?
Hello, my name is Juliana Schiffers. I'm a Bachelor of Arts graduate in Political Science from the University of Maryland, Baltimore County. Prior to Public Health 360, my experience was mostly in advocacy, journalism, and advocacy-related research. So this is a very exciting new field, and I'm looking forward to looking at a more data-driven way of examining knowledge.
Dries. Unmute yourself.
Good afternoon. My name is Dries Duiteka, and I'm a doctor. I currently work as a monitoring and evaluation intern, and I have a strong interest in health system strengthening and community health. And I joined the Public Health 360 Fellowship to advance my knowledge of the field of public health. And today I will be presenting on the climate change and health education program, specifically in the methodology and evaluation section. Thank you for having me.
Thank you, Dries. Crystal.
Hello, my name is Crystal Stanley. I currently reside in Owington, Maryland, here in the United States. I received my bachelor's in health science from Virginia Commonwealth University in 2019, and I am a current candidate to receive my master's of public health with a global concentration from Liberty University over the next few weeks. Currently, I am a full-time SWA coordinator here in Maryland, but I joined PH360 with global health and education projects to essentially hone in on project development and utilize my skills to improve overall maternal and child health in various communities. And thank you all for joining today.
Celine.
Hi, everyone. I'm Celine, and I attained my master's in health science from University of Sydney. I'm originally from Australia, and here at George Washington University as a candidate for public health, master's in public health. I'm passionate about women's health and specifically breast cancer disparities in low-income countries, and glad to be here with everyone. Thank you.
Thank you. Michael Blackwood.
Hi, everyone. My name is Michael Blackwood, and I have a bachelor's degree in pharmacology from the University of the West Indies. I'm currently a master's student at the Memorial University of Newfoundland. And my current research area is looking at the impact of Canadian cannabis policies in Newfoundland and the wider Atlantic Canadian region with a focus on risk perception and driving perception. And I joined public health internship program to gain exposure and practical experience in public health. And it's safe to say that I've accomplished that. Thank you.
The last but no least, no way the least, Meg Rentoria.
Hello, everyone. My name is Meg Rentoria. I am from the Philippines. Currently, I am a full-time student completing my master's degree in international health at the University of the Philippines, Open University. I finished my bachelor's degree of science in nursing at Far Eastern University. I have over 10 years experience as a registered nurse working with children and adolescents in school community setting. I am interested to take part in scientific and nonprofit organizations contributing to communication strategies, health promotion, and research. Thank you.
Thank you so much. Folks, for all our guests who are visiting today, you're going to hear from these 9 fellows. Each of the fellows have passed through really, really rigorous training. They know that I'm usually not as nice as I am today on this presentation, but I can tell you that they have really passed through the rigors of the program. There have been very painful moments, but at the end of the day, I think each of us on the faculty will stand by them. We can attest to the fact that they will go on to change lives, to change population health, to change public health, wherever they are practicing, whether they are practicing here in the United States, in Canada, or anywhere in Africa. So this is a momentous period for us, and we are so excited. You will hear about their projects today. You can see how they have grown. You can see how the oral communication has transformed. So if you are an employer of labor, we are bringing you upon to you 9 solid public health analysts. Next slide. All right, so here are all of us that are supporting you. Don't be a stranger, feel free. I see here on my screen a number of our graduates from the last faculty, from the last fellowship who have joined us today because they were on this seat, you know, couple months ago. So, you know, thank you for coming out. Thank you to family and friends for being here. Next. Great. So on that note, this year we are doing something really new. We have invited two really important guests who are leaders in public health to come and talk to you, to come and encourage you, to come and bear witness as you graduate today. And I am really, truly pleased to have Dr. Marissa Rice, who is a captain in the United States Public Health Service. And the Public Health Service is responsible for majority of the agencies that provide public health in the United States, and they do work around the world. Dr. Captain Rice is a deputy director in the Office of Compliance and Program Monitoring at the Health Resources and Services Administration, which is part of the U.S. Department of Health and Human Services. Dr. Rice has done public health from city, county, federal, and led individuals, and also know what it takes to be a public health analyst and to be a public health leader. So please unmute yourselves and join me to virtually welcome Dr. Marissa Rice as our invocation speaker.
Thank you so much, Rami. Just doing a mic check. Can you all hear me?
Yes.
So if you heard me say mic check, you probably figured I am from New York. I'm actually from the borough of Brooklyn, and that's what we would do when we needed to text the sound. We would say, can I get a mic check? So welcome, everybody. It is so good to see you all. If you are a graduate, please turn on your camera. Please show me those beautiful smiles. Yes, we know Rami is very serious, and he probably made sure that you were going to rise to the occasion to be here today. But today is a chance for us to smile, for us to clap you all up and say congratulations. I was so excited when Rami asked me to participate, and especially on a Saturday, whereas we know many times we are moving about and doing things, but what a better way to spend than to talk to individuals who are committed to public health. I began my journey in 2000, and it was not part of the plan. I had planned to go to medical school. I was going to be a doctor. But guess what? I was okay with doing a shift. And this shift has been really wonderful. We're looking at what now, 22 years, and I still have the love and the passion for public health. So I'm going to be darting my eyes over because Rami sent me over a little bit of information about you all. But you guys worked in two groups to plan activities, especially as it related to the opioid abuse, which we know that is important and it is definitely relevant yesterday, today, and probably in the future. And so I am really excited, and I plan to sit around and listen to some of the presentations because you just never know. We may have some employment opportunities, and if I get to hear from you and I remember who you are, trust me, when we see these lists of hundreds of names, it's always good to be able to put a face and a name and say, hey, listen, I remembered. And yes, I realize some of us are not here, but there are times also when the government has positions that are not just in the States, they are all over the place. But either way, consider me to be a resource for you. And then I also saw that you all were looking at the negative public health impacts of climate change in Prince George's County. Well, guess what? I used to be a Montgomery County resident, but just as of February, I am now Prince George's County resident. So I'm really excited to hear about what's going on. Yes, it is exciting. I've graduated up my children. They are adults, young adults now. They stay out of my pocket. My bank account has increased a little bit since then. So it's really exciting to be here. So just want to talk to you all about this journey. Many of you come with a lot of experience, I've heard already. Some people are doing research. I heard someone talk about nursing. I heard somebody talk about pharmacology and all of those different things. So you have the skill sets to take it to the next level. I've heard even someone say we went from doing this, I think environmental I heard, and now someone's shifting. I think that's one of the faculty members that talked about that. I was a sanitarian in my former life at one point, and it was because I was not afraid to say, let me see what this aspect of public health is about. And I enjoyed what I did, but guess what? That also led to the experiences of me sitting down and networking, working with mentors to be able to say, this is just not enough. There's other things that I want to do. So therefore, just going back to just talk about how my journey has shifted, which I think is always very interesting to share. You know, I went from working at a health department in Toledo, Ohio. Many of you probably never heard of it, but if I say Detroit, you probably say, okay. So it was 45 minutes outside of Detroit. It was there that I was having a conversation because I was working with individuals who tested positive for HIV, was impacted by HIV, syphilis, and what the work I was doing was called a disease intervention specialist. And so I sat down with someone from the CDC and I was telling them about, I feel as though I have more to give. I feel as though I'm ready to take it to the next level. And she asked me, had you thought about a federal career? Not really. And so I said, well, I've always wanted to work with the CDC. Going to school in Atlanta, Georgia at Spelman College, had a course that was taught by someone from the CDC. She says, you know what? I don't necessarily know if your skill set fits the CDC, but what about this organization called Health Resources and Services Administration? Now, most people will say, what do you mean you don't think I'm good for the CDC? I actually had to do a little self-check on myself and say, hey, listen, she's the person with the experience. Listen to what she has to say. And I promise you, in 2005, I started at Health Resources and Services Administration, and guess where I still am? 2022, I'm still with the Health Resources and Services Administration. So did she have the knowledge to steer me in the right direction? Absolutely. And so we talked about it, and I got involved with a program that was called the HRSA Scholars Program. And so it was the best thing that ever happened. And I'll be honest with you, at that time, I was married, I had kids. I was like, I'm not a scholar, I got a master's degree. What is this? Trust me, it was the best thing that could ever happen. I share that why? Don't ever negate any experiences that folks bring to you. If you put your trust in a mentor, trust them to lead you to where they need to be. If you're finding that the moves that you're making with that mentor is not working out well, I don't say sever that relationship, but you may want to think about expanding, and it's okay to have more than one mentor. So while at the Health Resources and Services Administration, I learned more about the public health service. Now, she had told me about the public health service, and guess what I told her? Oh, no, I'm not deploying all over the country and all over the world. I'm not doing any of those things. Well, guess what happened? Then that's why I say never. 2007, what happened? Marisa got commissioned as an officer in 2007, rose the ranks from lieutenant commander into where I am right now with captain. So as you all have done this journey, working with the faculty, you see all of the possibilities that are available to you to be able to expand the different things that you do. Make sure you all stay together, support each other, keep each other lifted up, because I promise you, you will hit some roadblocks, you will have some doors slammed. But I am a firm believer that when one door closes, and it's not cliche, when one door closes, another one opens. I wanted to share with you an experience I've had with a student. I had a student come to me as a volunteer, and who would have ever thought that her experience would go from being a volunteer into the HRSA Pathways program. HRSA Pathways program is not just for individuals that are in college. They also have the recent graduate programs. So many of you I heard stated that you were recent graduates. You may want to look at that. You want to also make sure that you set yourself up with a USA Jobs account. And even if you're not thinking about going into the federal career, it's still something to have, because you'd be surprised when some type of announcement comes through that may be of interest to you all that you may want to think about. But anyway, this young lady came to me. She became a Pathways. She worked on her master's at University of Maryland. She parlayed her bachelor's and master's, did the 5-year program. We ended up determining that it was not going to be a good fit for her to remain in our office just because of the dynamics. It was heartbreaking to her. There was a lot of emotions that was expressed, but I told her, I said, guess what? I am a firm believer that something is going to come through for you. Fast forwarding a couple of months, I'm talking to a colleague in another bureau, and I mentioned to her, do you have any positions? She said, absolutely, I do. What do you have in mind? I said, listen, I have a student that it's not a good fit for her. I think what she needs for her public health career, just starting out, is a little bit more deeper than what I can provide. What that did for me is I own it. We just did not have the resources and the opportunities that I felt she needed, but another colleague did. So there was a selfless act to be able to say, let's shift this there. I'm proud to say that this young lady is going to be employed. She's going to remain with the agency because we were looking out for each other. It was a village that wanted to be able to shape this young lady's experience and allow her to continue into her public health. So as you see, you have Rami here, you have Dries, I think I said it right, Crystal, Celine. Some of these names are a little complicated for me, but I'm going to say you and you and you and you. Make sure that you remain that village to support each other, to keep each other lifted up, and keep checking in on each other. The last thing I will say is, because I am not a woman that's going to keep going on, and I want to get to hearing about these presentations, feel free to use me as a resource. Rami will tell you, I'm going to drop my email in the chat. I expect to hear from you. I can share more about what I've done and the experiences that I've had and kind of help you navigate. I can be a resource. I have no problems with doing that. And then, as you know, we've all come through this COVID-19, right? We're coming out strong. I'm still a mask wearer when I'm out. People may look at me like I'm crazy. I'm going to keep that little mask on, because guess what? I have learned that I have probably gotten away from being able to get the common cold and other things like that. But just look at all of the things that you had to sacrifice during this time, but you still came out strong. So I want to see some smiles. I am not going to shut up until I see some smiles. Let me see. Michael, I don't see a smile. Where's the rest of my crew? Dania, I see you. I see Alan has a smile. Meg, Juliana, Miss Perry. I'm just going to say Miss Perry because that name is a little challenging for me. It's probably easier. But smile, clap yourselves up, give yourselves a hug, give yourselves a pat on the back. You have done it. So I expect to be getting the email from you all, even if it's just to let me know how you are doing. Rami knows he can reach out to me in the future. But thank you so much for allowing me to be here, Rami. And I appreciate this, and I cannot wait. Are we going to get to ask questions of them when they present or not? Okay, great. Well, thank you all very much. And I'm going to pause here. If there are any questions you can ask, if not, we'll take those a little later. I'll hang out with you all, Rami, for a little bit.
Please let us give Dr. Rice a rounding applause. So you have the pathway open for you. You know, I hope you will consider to take that pathway. And Marisa, thank you so much for your support. You know, I came to the agency knowing nothing about public health, but Marisa held me in her hands, you know, walked me through that wall. When things became really tough, you know, she said, you know what, this is only a passing phase. And I can tell you, I came to that agency as an analyst, and I transitioned from that agency as a director. And I really hold her in a special place in my heart. So if you hear from her to say, reach out, she does really mean reach out. Thank you so much. So I know we are excited. I know Dr. Thompson is already here, but let us get this first presentation out of the way and ask them questions. Let us get it. So group one, are you guys ready? You tell Brian how you're gonna do it. You know, I'm just gonna be on the steering, on the passenger seat and shut my mouth. I've been talking for 3 months. Now is your time to show the world how ready you are to encounter public health. Who do you want Brian to give access to?
Yeah, go ahead and share your screen, please.
I can share. So first we're going to begin with Jada. Jada is our executive director. She's very accomplished, and it would be my pleasure to have her introduce our project to you. Jada? Is Jada there?
Jada, you are muted. I think you're speaking, but we can't hear you.
Jada, we can't hear you. Okay.
Hi, can you guys hear me now?
Yeah.
Yep.
Perfect. I apologize. Yes. Good morning, good afternoon, and good evening, depending on where in the world you're currently tuning in. On behalf of my team of the Climate Change Health and Education Program, I would like to thank the staff at Global Health and Education Projects for providing this platform to present our program proposal. We will also like to thank today's audience for dedicating your time to listen in, and we hope that you find our program to contribute greatly to the ongoing efforts addressing climate change across our world. So this is a brief overview of today's agenda items. We are going to be touching upon a lot of different details and aspects of our program. So again, we just thank you for devoting your time today, and we're open to any comments or questions that you have at the conclusion of our presentation. Over the past several years, many countries have been afflicted by the burden of global climate change. These changes in weather patterns include frequent droughts, melting glaciers, and warming oceans. Climate change is heavily influenced naturally and by human activity, including but not limited to burning fossil fuels, deforestation, pollution, and agricultural practices. Because of these practices, climate change has been known to cause serious health risks among various populations. And these risks include, and again, but are not limited to, early mortality rates, infectious disease, and in some cases, mental health. Did you know in 2020, Prince George's County had the hottest record with 26 straight days of 90-degree Fahrenheit heat or greater? The impact of climate change among the global health population has not been created equal. Research related to the impact of climate change has revealed that urban and underserved communities are disproportionately affected by the impact of climate change. Ironically, these communities are less likely to contribute to environmental sustainability initiatives due to the lack of education. For our fellow public health professionals on the call today, you understand that level of education can serve as a determinant to health outcomes. In this case, the lack of education does pose as a barrier to these communities partaking in climate change prevention initiatives. As it relates to many other pressing public health issues, education is very significant to promoting climate action. That being said, the Climate Change Health and Education Program will aim to address this gap in climate change education among the citizens of urban and underserved communities in Prince George's County, Maryland. Did you know, according to the National Center for Science Education, 40% of teachers who integrate climate change into their science curriculum teach it inaccurately? So as stated, climate change involves the shifting of temperatures and or weather patterns, warming oceans, and also an increased rate of natural disasters. Because of this, climate change can aggravate both communicable and non-communicable diseases by up to 58%. As you can probably assume, climate change can be deadly. Specifically, it is expected to cause 250,000 deaths between the year 2030 and 2050. And furthermore, as stated before, climate change can exacerbate mental health vulnerabilities. So again, vulnerable populations such as the urban, poor, and minority populations receive the least climate education. And because of this, they also bear the greatest climate burden. So as mentioned, our program will aim to address this issue, but through interactive education, educational modules. Through this, we're hoping to promote climate change awareness and necessary mitigating behaviors. And now I'll turn it over to my colleague, Dr. Dris Duhiteka.
Thank you, Jada. And I'll be presenting on our goals and objectives we prepared for this project. As the first objective, we'll We're planning to increase awareness of climate change and its negative impact on health through climate education. The second objective will include increasing knowledge of human actions to mitigate climate change. And lastly, we will promote actions to reduce climate change through tree planting. Next page.
Okay, so I'll be providing you with a program overview and more details about our work plan and methodology. So Climate Change, Health and Education is a virtual module-based interactive educational program that aims to educate the residents of Prince George County about the negative impacts of climate change and the behaviors that have been scientifically and statistically proven to mitigate climate change. In particular, CCHE focuses on tree planting, whereby it provides thorough training on tree planting techniques, tools, and safety precautions essential for building the participants' knowledge in their ability to plant trees. So just to provide a little bit of an overview, why do we need this? Or why is it an educational program in the first place that we need? According to the United Nations Educational, Scientific, and Cultural Organization, UNESCO, education plays a pivotal role in promoting climate action as it provides people with the knowledge and the skills that helps them recognize the significance of this issue and the attitudes that are needed to act as agents of change. So the problem actually stems not from the unwillingness to learn, but rather from the lack of education itself or the spread of misinformation. According to the National Public Radio, 84 and 86% of parents and teachers recognize the importance of implementing climate change education in the school curriculum. But in reality, only 42% of parents discuss climate change with their children, and only 42% of teachers who do teach about climate change And from those 42% of teachers, according to a national survey, actually 33% of them teach about climate change inaccurately and imprecisely, or without providing the necessary scientific evidence that backs up their claim. So the lack of proper education is alarming, and as it threatens to raise a misinformed or even ignorant generation that is unaware of the severe consequences of climate change on our health and environment. And this actually brings Climate Change, Health and Educational Program aiming to actually address this issue. And we wanted to establish our program virtually in order to be very accessible. So please, next slide. Given the urban atmosphere of Prince George County and the diverse ethnicities that populate the area, we, the CCHE founders, decided to execute our project in Prince George County. Prince George County has a population of 910,306, whereby, according to the United States Census Bureau, 64.1% of the population are Black / African American, 27.2% are white, 20.4% are Hispanic / Latino, and 4.4% are Asians. Next, please. So regarding the inclusion criteria of our program, participants must be residents of Prince George County, Maryland by the start of their training. They must be 14 years of age or older to complete the educational modules. And if they do opt for tree planting, which is going to be optional, they have to be between the ages of 14 to 65. Further, in order to expand the inclusivity of our program, we plan to provide the necessary accommodations for participants with physical and cognitive disabilities. Next slide, please. So towards the end of the program, the CCHE team aims to achieve 300 to 500 followers across all social media platforms and accomplish a 10 to 15% increase in social media engagement. Secondly, to educate 50 participants on climate change consequences and mitigation strategies. And lastly, to plant 20 trees in 10 private homes in Prince George County, Maryland. So let's just dive in more about the details about how we're going to execute this project. So as we see here on the slide, the Gantt chart will appear. Oh, Juliana, are you able to press next? Sorry.
Yeah, it's no, it's on the Gantt chart slide right now.
Oh, okay, sorry, I just saw that. So the CCHE program is designed to be a 9-month program starting in January 2023 and ending in September 2023. The program's establishment and execution will be divided into 5 main steps as shown by the Gantt chart. So the first step focuses on program establishment and curriculum planning, which is comprised of 4 substeps. During the first month and a half, so from January 2023 to mid-February 2023, our training and educational director, alongside with the executive director, will reach out to the chosen partners and stakeholders, including university departments, graduate students, and field professionals, to commence the curriculum development. Simultaneously, our dissemination and outreach director will reach out to the digital marketing companies, local libraries, and all other stakeholders that would be detailed later to begin the establishment of the social media pages and the marketing process of our program. And that will start from January and end in mid-March 2023. So the development of the curriculum, including the incorporation of the pre and post assessments, will take place from mid-February to the end of March, which will then be followed by the filming and editing process completed in collaboration with a video editor and videographer to release the high-quality interactive educational modules, and that would take place through the month of April. The CCHE website will be designed by a software engineer during the month of February 2023. So the second, third, and fourth steps of our program focus on participant recruitment, the intake process, training, post-assessment. So the CCHE intake will be on a rolling basis. We're going to have 4 cohorts starting at the beginning of the months of May, June, July, and August 2023. Social media posts, beside the distributed flyers and posters, will be used to market the program and recruit participants. So during the first week of each month, participants will have the time to complete the intake form and the pre-assessment in order to gauge the extent of their knowledge regarding climate change, and that will serve as an evaluation tool for later on. Following the intake process, participants will have 3 weeks to complete the 5.5 hours modules alongside the post-assessment. And if they consent to opt in for tree planting, 2 trees will be transported to each participant's house during the month of September. And then to just make it more accommodating, we will accommodate the day for what works best for the participant, and a field supervisor will be also present during the day of tree planting to supervise the participants while they plant trees and also to further share their knowledge about providing proper lawn care. Next slide, please. So just before we talk about our educational curriculum and the different modules, we want to show what model we follow to develop those modules, and that's the health belief module. So the health belief model is comprised of 6 constructs. It suggests that individuals tend to take preventative measures when they believe that a disease or an illness threatens them, combined with their belief that the suggested behavior is effective to protect them from the threatening illness, disease. So as seen here, the first 2 constructs are the perceived susceptibility, perceived severity. So showing how, for example, climate change can lead to illnesses and diseases. Perceived severity, how through severe weather conditions can lead to actual death due to climate change. The third construct is the perceived benefits. So through tree planting specifically, you're going to see beautification, improved air quality. The fourth construct, perceived barriers, we're trying to address this by actually providing the knowledge, because participants usually feel that they lack the knowledge on how to change their behaviors, and by presenting them with the behaviors, the proper ones that are environmentally friendly, we'll be addressing the fourth construct. The fifth is the cue to action. As you're going to see later, we're going to be providing gift cards and the free trees to plant and beautify their backyards at their private homes. So hopefully that will motivate them to take initiatives into addressing climate change, and lastly, self-efficacy. Our educational curriculum will be thorough. It will be involving demonstrative videos from professionals, and it's going to be integrated within the educational modules, and hopefully that will give them the confidence in their ability to take action. Next slide, please. So I'm going to present to you our educational curriculum. Our virtual educational program consists of 5 interactive modules available on our website, presented here. Participants are expected to complete the educational training within a period of 3 weeks following the registration confirmation. Next slide, please. Prior to each module, participants will complete a pre-assessment consisting of 3 questions, totaling up to 15 questions for all 5 modules. And following the completion of the 5 modules, individuals will be asked to complete a post-assessment consisting of the same 15 questions. Upon the completion of the post-assessment, participants will be asked to fill a satisfaction survey to obtain feedback about their experience with our program. So, the first module will be titled, What is Climate Change? A Comprehensive Introduction to Climate Risk and Consequences. So this module, with a length of 1.5 hours, is actually based on the first 2 constructs of the health belief model, which is perceived susceptibility and severity. So we kind of want to spark the fear in order to grab attention and demonstrate the significance about caring about this issue. The second module will be based on the 3rd and the 4th construct, which is titled, What are the proper actions and behaviors that help mitigate climate change? So that's going to be based on the 3rd and the 4th construct, perceived benefits and barriers, and it's going to be 1.5 hours in length, and it's going to demonstrate the mitigating behaviors that we can take part in to address climate change. Module 3 is focused on tree planting in particular. So it's going to be titled The Importance of Tree Planting in Mitigating Climate Change, an Evidence-Based Approach. So our curriculum would be scientifically backed up, and it's going to be 1 hour in length, and it's based on the 6th construct of the health belief model, which is the self-efficacy, providing them that with the ability that they can do the action. Module 4 is demonstrating how to plant a tree, the tools, safety, and all the lawn care, all the information you need to know about tree planting. And it's going to be 1.5 hours in length. And lastly, Module 5 is going to be the environmental reward, showing them how they're going to benefit, or like what is the reward that the environment will give back, such as like improved air quality and other things, as well as gift cards and the trees that they're going to get. And that's based on the 5th construct, which is Cue to Action, and it's going to be only 10 minutes in length. Next slide, please. So a price per module is going to be a $5 gift card from a local garden center, and the gift for participation after completing the program, if you opt in for tree planting, it's going to be 2 trees for planting that's going to be transported to the provided address.
Thank you.
On to Jada. Sorry.
Okay. Thank you so much, Dania. So now I'm going to go into a little bit more about our organizational capacity and program management. I think it's important for us to introduce ourselves as the faces behind the Climate Change Health Education Program. I am very proud to say that our team brings a wide range of skills and expertise that will allow us to undergo a more multifaceted, holistic approach to implementing the program. First and foremost, Dr. Dris Duhiteka brings experience in evaluation methodology from his professional experience as a doctor in surgery and medicine. I, Jada Lanty, have experience in statistical analysis, communication, and building connections from my time as a public health student. My colleague, Juliana Schiffers, she brings experience in communications, journalism, and research from her time as a political science student. Next, my colleague, Dania Alkasab, she has experience in tutoring, mentoring, training, and research from her time as a Bachelor in Science student in Health Sciences. And last but certainly not least, my colleague Archine Perry. She brings a wide range of experience, including clinical science, program evaluation, healthcare administration, and training. And she's also a doctorate in public health candidate. So in his role of Chief Science Officer, Dr. Duhiteka will be conducting quantitative analyses of our team's findings in conjunction with the Chief Evaluation Officer. In my role as Executive Director, I will be managing all the projects across the organization while helping my team market them to grant management officers, as we're doing here today, and from a general sense, just helping to direct the team. In her position as Evaluation and Methodology Director, Mrs. Perry will be writing surveys for the use with both the educators and students within the program, and she'll be working closely with Dr. Duhiteka to translate his data expertise into evaluation products that we'll disseminate later on. In her role as Training and Education Director, Ms. Alkasab will be collaborating with curriculum designers, direct training, recruiting, and collecting data from our participants. And finally, in her role as Communications, Outreach, and Dissemination Director, Ms. Schiffers will be directing all dissemination and communication efforts, in addition to forming those essential partnerships and acting as a recruiter for the participants within our program.
So now we're going to shift to partnerships and stakeholders. Due to the fact that we're a small program, it's really imperative that we have a wide variety of partnerships. We selected educational consultants from the University of Maryland, specifically from the Department of Environmental Science and the Department of Education, University of Maryland, College Park. Department of Education will help us shape curricula in conjunction with Danya to ensure we realize our program goals, while the Department of Environmental Science will provide graduate students in environmental science who will train undergraduate sub-trainers. However, we also need supervision for the optional tree planting. So Abby's Farm Wholesale Nursery and AgroLawn Incorporated will provide trees and yard care equipment. They will also provide master gardeners to supervise the trees, make sure they are watered and raised correctly. AgroLawn Inc. will also provide gift cards between modules to participants. We would also like policy support, so we're going to work with Prince George's County Tree Relief Program. The Tree Relief Program focuses on planning with nonprofits and municipalities. However, because they have so much expertise in tree planting already, they will be effective in guiding us. And finally, the Prince George's County Climate Action Commission, which wrote the Climate Action Plan within Prince George's County Council, will support us with our sustainability goals. Finally, for tree planting, in very rare and unfortunate instances, some people have been injured while planting trees. So we're going to hire a insurance company for injury liability. As far as dissemination, that's also somewhat complex. For content creators, we're going to work with Dragonfly Digital Media and the Media Experience Film House. The Media Experience Film House is a videographer and video creation company, while Dragonfly Digital Media does search engine optimization, social media creation, and social media strategy. We will also create offline print materials with Vistaprint, which is an online company, distribute them at local libraries throughout Prince George's County. Okay, Dr. Dries, take it away.
Thank you, Juliana. And now I'll be presenting the monitoring and evaluation plan we have prepared for our project. So in order to track the progress and evaluate the outcomes of our project, we have included a monitoring and evaluation plan into our presentation today. And this plan will include us talking briefly about how we trace the inputs and the targets and how we collect the data. We will be gathering from the program from start to finish. This means that Our first outcome will include achieving 300 to 500 followers across all CCHE social media platforms and accomplish a 10 to 15% increasing trend of social media engagement. For this, we count on gathering a number of followers engaging with dissemination every month. And this data will be collected bi-weekly by the dissemination director and social media manager. We'll also be taking into account the number of likes or reshares per post. This would mean that our target is 1,000 reshares or likes benchmark. And here again, this is where we will be calculating our 10 to 15% increase in trend. Next page. Next slide. Oh, thank you. And for our second outcome, educating 50 participants on climate change consequences and mitigation strategies, we are planning to count the number of sessions conducted by educational consultants for the curriculum development. And our target here is 5, 2 per organization to be precise. And how frequently we'll be collecting the data? We will collect data from weekly meetings, and the person responsible for this task will be the training and educational director. Our second indicator to take into account under this outcome is the videographer and video editor, the number of videographers and video editors produced. And we plan that our content will reach at least 5 out of 10 satisfaction by participant. And lastly, we hope that the number of engaged and participants that participated in recruitment and are actively participating in module completion in all 4 cohorts will reach at least 50% every month. And again, all these data will be collected by the training and educational director together with the dissemination and outreach director and the executive director. Next slide. For outcome number 3, planting and providing proper care for 20 trees in Prince George County, we will be counting the number of trees that were successfully planted. And of course, our target is 20 trees. We will also be collecting some data, but following only the last intake. And the responsible person for this will be members of the CCHE staff alongside some of the staff of our partner organizations. And we will also carry out evaluations at the midpoint of our project and also at the endpoint, of course. Thank you.
Thank you so much, Dr. Dries. And now we've come to dissemination. Dissemination is imperative, so we selected the most effective and widespread platforms available: Facebook, Instagram, and TikTok. We're going to use social media as a recruiting mechanism because they reach across generations amongst these 3 technologies. Facebook covers an 18 to 44 age range primarily, Instagram 18 to 34 age range primarily, and TikTok similar. You'll notice this skews a little younger. We're spreading our efforts amongst different generations as necessary, but we'd like to have a bias for younger generations in general, but not oversample them so much that's only younger people. But the reason we're oversampling is that young people have a greater anxiety about the climate. And for teenagers and 20-somethings, they're in a uniquely malleable time in terms of learning and impressionability in their lives. They're also definitely still in a learning mode amongst their lifespan. So to adjust to climate anxiety and climate ignorance, we have focus on pain points to adjust our content over time and corner the market. We'll address climate anxieties while satisfying curiosity by serving as a dissemination hub for correct and neutrally toned information. Our social media posts will include, but are not limited to, the following: scientific and evidence-based educational posts, such as climate change facts, statistics, environmentally friendly behaviors, and more. Advertisements for upcoming virtual open houses and online events facilitated via Zoom. So definitely going back specifically to our modules. And for participants who have completed, satisfaction quotes that are visually displayed in beautification results, such as tree planting. Despite being a virtual program, CHE representatives will reach other generations through print and offline media. Employees will distribute educational posters, flyers, and brochures to local community centers, libraries, churches, schools, and universities. There will also be a QR code at the bottom there that can be scanned to facilitate access to our website. Take it away, Mrs. Perry.
Budget and closing statement. Okay. Our budget, we worked hard to keep it within perspective, but the projected budget for personnel was $425,000. Consultants was $71,000, travel and per diem $30,000, equipment $14,000, and indirect $54,000. As you can see, the total at the bottom of the screen, and this is just a projected snapshot of what we expect the budget to be. Next slide, please. So, our program focus on climate change education will ensure learning success for the entire Prince George's County community. After tracking the urgency of the climate education gap, our program will begin to bridge the divide between different ethnics and socioeconomic backgrounds. Tree planting cements the knowledge of beautification and otherwise lost appreciation of skills of nature for nature itself, which highlights the importance of education participation to volunteers. The health belief model meets people where they are. They help explain to them their unique susceptibilities to climate change and the severity, benefits, self-efficiency, and barriers breaking are provided within the modules. Thus, both climate anxiety, climate ignorance are tackled by providing a comprehensive curriculum. And we thank you for joining us today, and we'll open up the floor for any questions.
Please, this is terrific. Please join me and give them really, this is fantastic. So this program addresses real life problem, right? I like in the concluding remark, you can see that there is climate anxiety and lack of education. There is an anxiety, but we don't know what to do. But I think this program, uniquely tries to address those two and then give something specific for people to do in order to be part of solving the problem. Good. So we have 4 minutes of questioning. So please, for your questions, feel free to use the chat feature, or you can just raise your hand, or you can just unmute yourself and pose your questions. I think I see Marissa's hand is up.
Yes, this is a great presentation, and I'm just pleased because I know that tree planting and taking care of our environment is really important. I'm a member of Alpha Kappa Alpha Sorority Incorporated, and it's actually one of our initiatives. And I am so upset because I'm still in the Montgomery County chapter, and this would have been a great partnership. And so, we got to be careful of crossing boundaries. But what I wanted to ask is, even though I know this is a project, what is the feasibility of us doing something like this in Prince George's County? I just built a house and I have plenty of space to put another tree. So I'm just trying to figure out, how can I really make this happen? Is this something that we can actually, accomplish? And then the other question I had was, there was a slide where you talked about the impact of the environmental health or just taking care of environment or mental health. I wanted to see if you could expand a little bit more on what you meant by that. Thank you. This was great.
Yeah, hand it over to the team to answer the second question, and then GHEP will answer the first question.
Yeah, sure. So I can take that question. So from my understanding, you're saying the second part, you're asking about mental health and how we're going to address, as a result of climate change, correct? Okay, perfect. Yeah, so that's going to be a huge component of our educational series. As Dania had outlined, it's going to be part of one of the episodes and really trying to highlight, this is an additional result that, really isn't touched upon in the public health sector. Mental health is something that's, I would say, more like, incidental at this point and more upcoming, and it's more of a topic of interest. So, we do aim to highlight that through one of the modules. So thank you.
All right. Let me know if you need any resources related to that.
Thank you. Really appreciate it.
In terms of implementing, Marissa, I think that's a good discussion to have. We can implement this GHEP in collaboration with the team. And I'm sure Mayor Thompson is going to say something today about that. Our city, the town of Riverdale Park, did actually a tree summit today. So I'm going to leave that. I'm not going to steal his thunder. I'm going to leave that for him to take that segue. But GHEP also is doing a number of tree planting programs. We have been planting trees for the county for 5 years now. And so we can build off of this, and climate change is a new area for us. So working with the team wherever they are and, partnering with another organization is something that we will be very much interested in. Don't get scared by the budget, 500, $500,000. They have been trained to do pilots. They can always bring it down in order to execute. Chidubem, you have a question.
Yes, so that was a great presentation. I really enjoyed myself listening to the nice ideas, the structure, and the way you guys presented the topic. And I'm really interested in knowing how you guys would want to address cases of resource wastage. So in a case where someone indicates interest and the tree is being shipped to the person, and how do you intend to checkmate to make sure that the tree is being looked after, watered till it's grown?
I think I can answer this question. One of the ideas we were actually discussing is that providing updates through taking pictures of the trees. Also maybe like checkups in collaboration with the local garden center, maybe field professional checkups to see that the trees have been taken care of, after all, like sharing all the knowledge about how to take care of it and after planting it. But mainly we were thinking about taking continuous pictures, checkup pictures, how's the tree doing, its growth and all that.
Thank you.
Of course.
I do like checkup pictures, actually, taking pictures, and returning it back to the program office. I would be curious to see, are there apps that somebody can use that you can just do this and send it so that can be downloaded by the program office and make it easier for the families to engage. So that is really something. And Chidubem, a good question. Tree maintenance is a major problem. One thing is to plant the trees, but educating the members in order to take care of those trees over time, especially when they are new, is key. And I'm glad to hear that this program takes both virtual, but has an underground component to it. So terrific. Congratulations. Thank you for a nice job. And group one, I think you guys are now under immense pressure to outdo this group. So no pressures, but just trying to let you know. So on that note, ladies and gentlemen, I want to introduce the mayor of my town. Like I mentioned when you joined the program, the Global Health and Education Project is based in the town of Riverdale Park. The town of Riverdale Park is a very diverse community in the state of Maryland in Prince George's County. And I'm so glad to call this place home since 2004. And I don't think I'm going to leave this city. So Mayor Thompson is the mayor of the town of Riverdale Park. He has been a great supporter of GHEP. Before COVID, when we used to have our annual event, the mayor will be there, every day, bringing, meeting members of the community, fostering a diverse community. So we are so pleased to have him today presenting our commencement speech. So I would like to invite you all to unmute and join me to give Mayor Thompson a rounding welcome applause.
Thank you all, and thank you, Romy, for the invitation to speak today. I really appreciate the opportunity to be with you today. It's been a pleasure to work with you on so many projects over the years with you and GHEP, and I look forward to working together in the future on other projects. And I'm very proud to have GHEP in the town of Riverdale Park as part of our, as you say, very diverse and increasingly diverse community. I also appreciate, Romy, the flexibility on the schedule. As you said, I was committed to being at the tree summit this morning that ran over until about 12:30, and appreciate that you were in attendance for most of that event. As you hinted, the project that was discussed first, the one just wrapped up, is directly applicable to some of the issues that came up during that summit. And I'm looking forward to seeing if we can borrow some of your materials, get involved with that project. So I'd like to move on and give my congratulations to all the graduates from the first project. This is excellent work. It's high quality work. It's something that can be immediately applied and will be useful for doing, for improving the quality of life for people in Prince George's County. And I look forward to hearing about the second project after my remarks. So I'm going to sort of start out just by expressing my appreciation for the entire field of public health. And I'll put this in the context of my own goals as mayor. So my goals as mayor and the goals I have for town government are creating an infrastructure for community. And I'm not talking just about streets and sidewalks, those are important. I'm also talking about the fact that we want people to get out of their houses, to get out of their cars, to interact with each other and to form a vibrant community where they think of each other as members of the community and they know each other through that context. And that work has kept me very busy, and I have not, I won't say ignored, but just been aware of and monitoring, but not necessarily getting too deep into other things that are more important, that are even more of a deep infrastructure, the infrastructures that support society as a whole and the infrastructures that support civilization. And public health is one of those. It actually supports civilization. It allows civilization to exist. It allows the quality of life to improve over time. And I'm so excited to see so many people entering public health and learning more about it through this program. And if we want to see how important public health is for civilization, then that has been clearly revealed during the COVID-19 pandemic. We've seen all aspects of civilization. The ability of people to work, to go to work, to do their jobs has been severely impacted during this pandemic. Access to education has been, which impacts civilization of the future, has been severely hampered by this. Commerce and business has been severely hampered. Many businesses here in Riverdale Park have gone out of business or had their businesses seriously threatened and needed support from the government to continue. Access to healthcare and the healthcare system as a whole has been threatened by this. And then perhaps not as obviously important, but still there, are things like socializing and community gatherings. The process of building community of having people feel that they are living in a community, in a supportive community, has been threatened. All of these are fundamentally important for people to lead productive and happy lives, and they've been threatened by this public health emergency of the COVID-19 pandemic. And the pandemic has also revealed both successes and challenges for public health. And I'm going to focus just on a few successes because I think it's good to do that. I think it's good to say, this is a public health emergency and we have seen successes. And so perhaps one example of that has been the very strict zero COVID policies that are in mainland China and also in Taiwan and that part of the world. I think that they had some practice with the SARS pandemic or SARS epidemic in their area, and they have been able to control it. There have been costs to that control, and it may not be ideal, but they have been able to do that using public health tools. So they have done contact and trace. They have done, when the immunizations are available, ring immunizations. They have done all of these fabulous tools that come to us from public health in order to maintain control. Perhaps an even better example has been the activities in New Zealand to combat the pandemic. So they have gotten societal buy-in in a very strong way. They sealed their borders for some period of time, and then when mitigations such as vaccination were more readily available, they reopened the boundaries and have had relative success in keeping COVID-19 under wraps. But we've also seen other challenges for public health that have been revealed for this. I think that the statement I read at some point is that the inequities of the United States healthcare system have been laid bare by the COVID-19 pandemic. So access to vaccinations, access to healthcare for those who get sick, all of these have been shown to be highly inequitable, impacting those on the lower end of the socioeconomic status so much more. We also see this at a national level, not just locally and internationally. I remember many months into the vaccination program here in the United States, seeing a news story about the first person in an African nation receiving their vaccination and how proud they were to be the first recipient. And the fact that after so many months here where we were begging people to get their vaccinations as quickly as possible, that only then were the vaccinations starting to come to other countries in the world was demoralizing. We've seen a lot of, at least in the United States, lack of adherence to public health guidelines. So there's been encouragement to get vaccination, to wear masks, to maintain social distancing. And many people are just ignoring this. And even at a higher level, there's been the politicization of public health. So people in some aspects of the political spectrum view that listening to public health is inappropriate and they don't want to do it anymore. This is a severe challenge that we all need to address. And as part of that, I believe that we need to improve coordinated messaging between elected governmental officials such as myself and public health officials. And I look forward to working on that in the future. And I said earlier that I didn't used to pay as much attention to public health as perhaps I should. I believe my own interest in public health will remain. We'll be navigating this pandemic and other public health issues for many more years. I will stay much more involved in the future. I'm going to conclude my remarks by thanking GHEP and ROMI for coordinating, for creating this program. I think it's fantastic. I'm very excited about the first project. I'm very interested in seeing about the second one. And I want to give my thanks to the graduates for their hard work in this program and for their future public health activities. And congratulations again. Thank you.
Thank you so much, Mayor Thompson. I really, really appreciate your words. They come home very crisp, the challenges, the successes, and all the key avenues. I think that's the training that we have given these fellows so that wherever they are in this world, they will be part of that solution. So please, again, join me in thanking Mayor Thompson for his wonderful presentation. And on that note, we're going to be jumping over to group 1 to be presenting on substance opioid use, which is another major public health problem. So Brown, if you can stop sharing so that they can grab the screen and share.
Okay, so can everybody see my screen? Okay.
Yes.
Thank you. So, ladies and gentlemen, a pleasant day to all of you. My name is Mary Grace Ventoria, or Meg. I am the Health Promotion and Strategic Director for this program. It is my pleasure to introduce my group mates, Crystal Stanley, Celine Prasad, and Michael Blackwood. We are the team behind community hubs for addressing misuse prescribed substances, also known as CHAMS. So to set your expectations, this will be the overview of our presentation. Our team members will take turns discussing the following key points of our proposal. Feel free to raise any questions after the presentation. And without further ado, let us hear from Celine to give you the executive summary of CHAMS.
Hello, everyone. My name is Celine, and I am the Director of Partnership and Outreach. And it is with great pleasure that my team and I present on CHAMS grant proposal, which is on opioid crisis in Canada, specifically amongst 18 to 24-year-olds. According to the Canadian Centre on Substance Use and Addiction, there were approximately 15,000 opioid-related deaths from January 2016 to December 2019. Emerging data show that nationally, there were approximately 3,000 opioid-related deaths between April and September 2020, which is an 82% increase in comparison to the same period in 2019. Therefore, these lives lost make this opioid crisis a major public health concern. And further to this, the statistics presented show that there is an urgent and immediate need to reduce prescription drug-related misuse, while maintaining a timely and manageable use of opioids for medical use. So to mediate this major public health crisis in Toronto, our team proposes a health education intervention program called Community Hubs for Addressing Misuse of Prescribed Substances program, CHAMS in short. The Toronto District and the Greater Toronto Area will serve as the test market for our CHAMS program. We chose to launch this initiative in Toronto because the city has experienced an extraordinary rise in overdose deaths due to the COVID-19 pandemic, according to the recent report by the Chief Medical Officer. And COVID-19 had a significant influence on Ontario, which was subjected to many lockdowns that appear to have made the situation worse. CHAMS program is a multifaceted health education intervention program that will target 200 participants, utilize 50 public health volunteers, and leverage technology via QR codes and the CHAMS app, with the key objective to reduce opioid overdose and substance use disorders. Together with our program sponsor, Global Health and Education Projects, we will be collaborating with multi-stakeholders, such as the Canadian Centre on Substance Use and Addiction and the Public Health Ontario, for a greater impact and to ensure successful completion of our program's mission. Upon successful implementation, our program will provide public health practice relevant dissemination strategies that could be adapted to other states and possibly nationwide. And now I will hand over to Crystal, who is our Director of Research and Program Development, to present on the problem statement. Thank you.
Thank you. Essentially, our program is going to be focusing on prescription drug overdose
and prescription drug overdose has increased during the past decades. There has been a widespread use of non-prescription and prescription drugs. Essentially, since the start of the COVID-19 pandemic, substance use disorders have astronomically increased, posing even more significant public health problems for individuals.
Crystal, just 1 second. Can you adjust your microphone? There is a lot of crack that we can barely hear what you are saying. Are you using your laptop microphone?
Yes.
Are you able to change to anything else?
It could have been there is another device nearby.
Can you speak now? Because we can barely hear you.
It
Can you
might
hear me
be the
okay?
volume.
Okay. So do you have a headphone or something now?
No, mine is a
It's better now. It's better now.
Better
So
now.
maybe you get closer. Maybe get closer to the laptop.
okay. Is it better?
Yes.
Sure.
Okay. All right. So essentially, we're going to be focusing on prescription opioid overdose, and the reason why is because the overdose has increased during the past decades. There has been a widespread of misuse in non-prescription and prescription drugs. And so since the start of the COVID-19 pandemic, substance use disorders have astronomically increased, posing even more significant public health problems for individuals, especially older adults. So 1 in 5 Canadians experience pain and have limited access to timely and appropriate care, and 1 in 8 people were prescribed opioids. And essentially, opioids are prescribed prescription drugs, and they are available in various forms, such as tablets, capsules, syrups, transmucosal preparations, nasal sprays, and injections. And so this dramatic increase in the acceptance and use of prescription opioids for treating chronic and non-cancerous pains essentially adds on to that overall opioid increase. So the substance use is associated with physical, mental, and social outcomes. And so substance use disorders officially can develop from addiction. And again, those essentially affect a person's overall mental and physical state, and we will get into greater detail about the specific ones. And so we are relating this to the COVID-19 pandemic, and essentially is contributing to the already deadly growing crisis, having a tragic impact and increased use in substance users, their families, and communities across Canada. And so I'll go ahead and turn over to Meg, who will be discussing our target population for this program. Sorry, Michael. Okay.
Thank you, Crystal. So as the monitoring and evaluation director, I'll talk about the target population for CHAMS. So we decided to pilot CHAMS in Toronto District or the Greater Toronto Area, the GTA, which is the largest city in Canada and the 4th largest in North America. We decided to choose to look at young adults for our program because the research has shown us that Canadians aged 15 to 24 are the fastest growing population requiring hospital care from opioid overdose. So therefore, we're targeting consenting young adults between the age of 18 to 24, with the inclusion criteria of being a young adult 18 to 24 who resides in Toronto District or the GTA, and we're excluding those under the age of 18 over the age of 24, those that reside outside of the GTA, Toronto, and Ontario, ultimately. Next slide, please. And I'll hand it over to Crystal.
These are our goals and objectives for this program. And essentially we do have 4. So the first one is to reduce opioid overdose and substance use disorders. The second objective is to increase awareness surrounding the dangers of opioids. The third is to increase proper disposal of opioids. And the fourth is to increase our questionnaire scores to an 8 or higher. And essentially, there is a questionnaire that we are going to be utilizing that we will discuss further in the presentation that will address people's overall knowledge and where they stand currently in regards to opioids and how to address them. So this is our goals and objectives in a more detailed chart. And essentially, we kind of outlined our goals for you all, and I will be focusing on the first two columns. So the first column goes over 5 goals in more detail that we want to accomplish by the end of the 6 months. So the first one is to build community capacity and receive buy-in from key stakeholders. And so essentially we want to secure 2 stakeholders overall. The second is to create awareness of CHAMPS among communities, hospitals, and surrounding clinics. The third is to increase overall knowledge and awareness of substance use disorders and prescribed opioid misuse. The fourth is to increase CHAMPS app download and interactions and increase proper disposal of opioids. And so with the app, you want to at least see 50 plus downloads and at least 30 shares after the second course of the overall program is complete. And as far as the disposal of opioids, we want to utilize and fill at least 5 of the 10 disposal areas in each of the community hubs that are going to be placed in our mobile hubs throughout the community. And in the other columns of the chart, you can see that we have our time frame and milestones in relevancy to why each category is going to help us achieve our goals of the overall CHAMPS program. So next, Meg, she's going to be discussing our methodology and program description for you all.
Thank you, Crystal. So for our methodology and program description, so the CHAMPS program is a multifaceted health education intervention program that will target young adults participants, utilize public health volunteers, and leverage technology in order to increase prescription drug abuse awareness and offer intervention classes to impact overall use. So in an overview, CHAMPS is planned to be piloted at the Metro Toronto Convention Center for 6 months beginning in January 2023. The Convention Center will be the main hub for all public health professionals, stakeholders, and volunteers to convene and meet bi-weekly. And as mentioned earlier, the program hopes to recruit at least 200 volunteers, 200 participants, and create 10 mobile hubs and utilize at least 50 young volunteers. The proposed program will take a multi-pronged approach and incorporate 3 key components. These are drug knowledge and education workshop, dangers and signs of substance abuse, a substance use disorder, and exit therapy, plus WeCheck via the CHAMPS app. So this program will also utilize technology and we'll be using the brief opioid overdose knowledge as a framework and scale for the program to observe the target population's overall perception and awareness of opioids and substance use disorder before implementing projects, and educational classes supplemented and supported by the CHAMPS app. All 3 components will happen within the span of a month, and after the month is completed, each participant will take the questionnaire again to determine effectiveness. For the course of 6 months, CHAMPS will run 5 total courses for the community. And to discuss further about key components, let's hear again from Celine.
Thank you, Meg. Now I will elaborate on the key components of the CHAMPS program. The CHAMPS team believe that it will take a community to impact change. Hence, we have developed a program that ensures that various stakeholders of the community at large are equally involved with the CHAMPS team. As you can see, the program will be conducted in 3 components. In week 1 and 2, we will conduct the drug knowledge and education workshop component. The mission of this workshop is to equip members of the community with the knowledge the participants need in order to gain access to different types of opioids, prescription drugs, and their purpose, and as well as to provide information on how to prevent misuse and addiction, as well as to facilitate discussions among participants. This program component will also develop health education materials to be distributed in the community at the main and mobile hubs, as well as various social media sites. The team hopes to partner with the Metro Toronto Convention Center and the University of Toronto to help with the facilitation and implementation of this program component. In week 3, the dangers and signs of substance use and disorder component will be conducted. This component will be implemented after a month of week 1 and 2 workshop and will involve physical demonstrations by the volunteers in order to elicit engagement from the participants. Each hub will demonstrate the signs and dangers of substance abuse as well as an overdose. In week 3, the participants will also learn what to do if they encounter an overdose or suspect one. These classes will take place 2 to 3 times a week before participants move to the final component. The CHAMPS team and the program sponsor will collaborate with Canadian Centre on Substance Use and Addiction and the Public Health Ontario. The last component, which will be held in week 4, is the exit therapy and recheck. This component involves the introduction of mental and emotional checks and sessions by professional community therapists. We believe including a mental health aspect will allow participants to discuss their overall experience from weeks 1 to 3 of the program and express their feelings regarding their drug use and addiction. The CHAMPS team will engage with the Center for Addiction and Mental Health and the University of Toronto Center for Addiction and Mental Health. And now Crystal will elaborate further on QR code and the book questionnaire.
Thank you. So the book questionnaire, which is the Brief Opioid Overdose and Knowledge framework, was structured by Johns Hopkins. And so essentially to bring in technology, since our target audience are adults aged 18 through 24, we decided to go ahead and generate a QR code that you all can try if you would like to generate the questionnaire. And essentially, this will generate the full questionnaire, which is comprised of 3 different sections. So next slide, please. Okay, and this is the questionnaire that we're going to be utilizing to essentially put people into the program if they score less than a 4 on this questionnaire. Anyone that scores higher than a 4 will be directed to one of our mobile hubs that will have other types of education programs and trainings, but won't be as intense as the program that's going to be done at the convention center. So the 3 categories that they are going to be asked questions are framed by opioid knowledge subscale. And then we have the opioid overdose knowledge subscale again. And then we have another set of questions that goes over response knowledge subscale. And essentially, these are ranged 0 through 4. And once these scores come back, that is where we will see which future participants score less than a 4. And so this, again, questionnaire compromised by Johns Hopkins has very important questions that we will utilize throughout our program to essentially see where people are in their knowledge and to essentially scale where the overall community is as far as addiction and substance use goes. Next slide, please. And again, so this questionnaire will be on our CHAMPS app, and Meg will go into greater detail about our CHAMPS app and what it will include for our participants and members of the community.
Okay, so the CHAMPS app will be developed mainly to support in educating, disseminating information, and reducing the misinformation the young adults receive about drugs, and replace it with reliable resources, emphasizing opioid misuse and overdose incidents through the use of technology. So in its early conceptualization, the CHAMPS app will have the following main features. So we have the book questionnaire integration, and then there will be a support community which will utilize trained volunteers for peer education as a support community, encouraging a safe space within the app network, like sharing testimonials and wins in their CHAMPS journey. There is also an option for helpline, which includes referrals and hub locators that provides physical locations for counseling and treatment with trained professionals, and mobile hubs that we will be dispersed. And then we also have resources that includes vital information on what to do in case of overdose, links to educational resources, journals, videos, and other materials. The app will also feature a user registration for progress tracker, which will provide for easier accessibility for the book questionnaire as one of the tools in the culmination of the program during the recheck. Next, Celine will be talking about our logic model.
Here you can see the outline of the CHAMS program logic model, which will be our program's blueprint and visual illustration of the program's resources, activities, and expected outcomes. We are using logic model to develop and implement this project because it is an effective tool to assist in program planning, implementation, management, evaluation, and reporting, and thus enable us to achieve our various short and long-term goals. We will use this model to achieve our overarching goal, which is to increase awareness and reduce misuse of prescription opioids in 18 to 24-year-olds in the Greater Toronto Area through community hubs, as well as utilize this tool for the program's objectives, which is to increase awareness and reduce misuse of opioids and prescription drugs by 50% in 18 to 24-year-olds in the Greater Toronto Area. And now I will hand over to Michael, and he will speak on the program evaluation.
Thank you, Celine. So our team will utilize a participatory approach involving many of our collaborators. This will ensure that we are operationally and financially accountable to each other. So in order to evaluate our CHAMS program, we will seek to examine the program structure, the impact, and the efficiency of the overall program. So we are going to employ three types of evaluation. So the first one is going to be a process evaluation, which is to evaluate how well the program is implemented and how well the program tasks are fulfilled per the proposed timeline. The second is a cost benefit analysis, which is to measure the benefit of the decision or our program and minus the cost associated with taking the program or the action. This will serve as a justification for our partners and a future reference for a full-scale program. And lastly, we will employ impact or an outcome evaluation, which is to assess if the program had the desired effect on the participants and to assess the extent to which the objectives and the goals were achieved. So ultimately, each aspect of the evaluation will be used to improve upon the proposed pilot program and to implement and tailor a program beyond the City of Toronto and potentially provincial-wide or Canada-wide. Next slide, please. I'll hand it over to Meg, who will talk about the program management.
So under the supervision and direction of GHEP, the management team of the CHAMS program will oversee and directly administer the proposed project from inception to completion. And the CHAMS teams comprises 4 individuals with educational backgrounds and experience to develop, implement, promote, and evaluate the proposed program. So the CHAMS team will be directed by Crystal Stanley as the Research and Program Development Director. So Crystal has years of experience working with vulnerable populations and program development in the area of public health. Her current research area of focus is on maternal and child health care access and service deliveries in underserved communities. And under her directorship, she will be responsible for the program's overall planning, coordination, research, and development. Next, we have Celine Prasad as our Partnerships and Outreach Director. Celine is a highly skilled public professional with extensive clinical experience and great interprofessional collaboration proficiency within the public health sector. She is firstly passionate about clinical and translational research to solve public health issues. Using artificial intelligence and utilizing her skill set, she will be responsible for actively developing and sustaining collaborative relationships with our key stakeholders. And our third core member is Michael Blackwood as our monitoring and evaluation director. Michael has several years of experience in pharmacy inventory and management, research methodologies, and health policy. His current research interest is based on cannabis policy evaluation, and as the evaluation and monitoring director, he will be responsible for developing the project framework and indicators to capture performance results and provide effective, accurate, and timely monitoring, evaluation, and reporting of all project activities. And to complete the working team, you have me as the health promotion and strategic director. I have an extensive professional background as an institutional development and health officer with a depth of experience in clinical management, communication strategies, and health promotion. So my research passion lies in area of adolescent health and school health practice. In my role in CHAMPS, I will be responsible for developing the communication strategies for engaging all the collaborators. And to talk about our partners in the CHAMPS program, let's have Michael back.
Thank you, Meg. So as public health professionals, we are well aware of how partnership and collaborations, they're important in the practice of public health, and effective partnerships are essential for community-based solutions for advancing health equity. So fortunately for us, Ontario has a plethora and a wealth of organizations at different levels at the local, provincial, and the federal level that are dedicated to substance use disorder, mental health, and or addiction. So some of our proposed partnership that we have is the first one is the Global Health and Education Project, which would serve as our program sponsor. They will be providing guidance and direction for our CHAMPS program. Next, we have the Canadian Centre on Substance Use and Addiction, the CCSA, which is going to be an external evaluator and a course resource involved in the course resource development. Then we have the Centre for Mental Health and Addiction, CAMH, which is Canada's largest psychiatric hospital, and they will be providing personnel and resources for our mental health therapy check-ins. So next we have the Family Outreach Ontario, which is a faith-based organization that specializes in addiction. Then we have Public Health Ontario, which is another external evaluator for the program. They will be offering pre and post feedback for all our program activities. We have the City of Toronto, which will assess and provide feedback regarding the program activities and progress. And lastly, we have the University of Toronto's various departments, the School of Public Health and the Center of Addiction and Mental Health, where they'll be providing volunteers. The university will be supervising those volunteers and reporting their performance and perspective on the project. Next slide, please. And I'll hand it over to Crystal, who will talk about the dissemination and the budget.
Thank you. So essentially, dissemination is important because we want to reach as many people as possible, especially in our target population. So the disseminating activities will be performed on an ongoing basis throughout the program's lifespan. And essentially, we want to raise awareness of the overall program and what it entails in Toronto, Canada, maximize participation in the program while achieving diversity and inclusiveness among participants, and communicate to the target population the benefits of participating in CHAMPS and provide resources for daily use. And so essentially the platforms that we are going to be using are going to be YouTube, Instagram, TikTok, journalists, advertisers, public relations personnel, camera crew, newsreaders, and librarians. And essentially, while we want to be cognizant of the fact that not everyone might have access to technology or all of these platforms, so we did include journalists and librarians so that we can reach a more wide base of people. Next slide, please. Okay, and I will also be discussing our budget for the overall program, and we did break it down by category. So we have budgets for the convention center, the mobile hubs, opioid disposals, volunteers, our media costs, classroom resources, food for participants, volunteers, or workers, staff trainings, program team, and technology. The description for each are in the second column. So the convention center is going to be the main hub for all primary processes. The mobile hubs are going to be located in schools, gyms, and churches. Opioid disposals are going to be collection bins in each of the mobile hubs. We have volunteers that are going to be teaching classes, leading seminars, and processing paperwork. We have the media costs, which is going to go towards journalists, advertisers, camera crew, news readers. We have classroom resources, which will include brochures, newsletters, and guided directions. The food cost is for participants and volunteers. Essentially, there's going to be 2 meals a day, $10 for meals, about the average that we're looking at. And we have staff trainings that are going to be guided throughout. And then we have our salary for the program team and technology costs. So essentially, we're looking at about over $266,000 for the overall cost. Next slide. Okay, and that sums up our CHAMPS presentation. So we want to thank you all for joining us today, and we will open the floor for questions.
Fantastic, fantastic. Please unmute and join me to give them a resounding round of applause. Nice job. So Brown, if you can stop sharing and bring us to try to do the conclusion of the program. So I have some questions. I think we have 8 minutes more. I have some questions for this group. Terrific presentation, wonderful presentation. One of my questions is, I know that you propose to do the program in person. Is it possible to make this program to become a virtual program so that we can limit the costs? Because right now you are proposing for people to come to the convention center and participate in the program. Given that we still have COVID, is it possible to adapt this program so that people can do some part of it virtually and then have minimum in-person interaction? So anybody who wants to take the question?
Yes, to your question, it is possible. Like I said, this is a pilot program, so it is moldable going forward. But I feel, or we as a team feel like having it in person would kind of break from the constant cyclic lockdown that Toronto experienced, and it's probably would be good to be out and about, seeing that Toronto has removed majority of the COVID restrictions, and COVID is kind of under control in the province of Ontario now. But going forward, to reduce costs, we could implement probably virtual aspect of the courses. We're just mindful of the fact that maybe individuals may not have access to, I mean, we're in the age of technology, but maybe individuals don't have reliable internet access and stuff like that. So an in-person activities also, you know, good for the mental health, but yeah, we'll take that into consideration.
Thank you. Thank you so much. Jada, I know your hand was up. And then after you, Mayor Thompson.
Yeah, sure. Thank you. This is more of a general question for your group, but I noticed that you guys had mentioned as part of your evaluation plan that you'll be using cost benefit analysis. So at my current job, a lot of the students and new professionals that I work with do research around cost effectiveness or cost benefit analysis, but mainly with like drug pricing or the pricing of other medical devices. So because I'm still fairly new to cost benefit analyses, just from a general sense, like, is that something you would conduct as your program is going on, or is that something that you would conduct towards the conclusion of your program?
We plan to conduct the cost benefit analysis before the program starts. Like I said, we wanted to kind of use it as a justification for collaborators or partnership to say, hey, this is not wasting money. Here are the numbers kind of thing. We would probably do one after to see how well we followed the budget properly, but definitely before the implementation of the project or the start of the project.
Thank you. Yeah, that makes a lot of sense. Thank you.
Mayor Thompson?
Thank you. This is a fantastic presentation, and again, another well-developed program. It looks very interesting, and I hope to see it actually happening. The question I have is that the program title implies that you're looking at at abuse of various prescription medications, but the focus seems to be on opioids. And I think given the impact of opioids and the addictive nature of opioids, that makes sense. But I was just wondering if the program would delve into other abused prescription medications such as stimulants, or that's the only other one I could really think of. And if not, what would be different about a program that targeted stimulants?
Good question. Not only for Michael, Group 1.
Do you want to take this, Crystal?
Sorry, I couldn't get to my unmute. So yes, so we did focus on the opioids, essentially because that's where we saw where the numbers were the most as far as Canada goes in Toronto, especially for the age group that we're focusing on, 18 through 24. And we actually did think about focusing on other prescribed drugs that do have high addiction rates. But I think we wanted to just kind of narrow down on our target so that we could focus on developing a program, a health education program that would essentially target this aspect first. And then once we see how this goes, then we can implement it to target others. So this is kind of just a starting basis for where young adults are currently standing in Toronto, Canada. We did find research regarding other drugs such as stimulants, like you observed, and we just thought the focus on opioids first going forward. And I think focusing on other prescription drugs, like you said, how would it look different? I think essentially the courses that we have in place, the weeks 1 through 4 would probably essentially look different, in the teachings that we're going to do. There will be a little coursework change in there. But I think the overall outlay or the format is going to be the same as far as what we want to target or relay to the target audience. So I hope I answered your question.
Definitely. Very, very important. And as someone in public office, I can tell you that there's always budget constraints, and you always try to get the biggest bang for your dollar, get the best result you can for spending money. So thank you for your answer. Appreciate that.
Of course.
So one way to do this is also to expand the educational component of the program. And if you do it using technology, you can actually do technology for the first, and then when they come in, you can review that. So that gives you a broader, so that you can have module talking on this stimulant, fentanyl, talking on each of them, educating them on the dangers. And then when they come in, part of your program will be reinforcing what they had learned, using technology. That's another approach to it. Chidubem.
Okay. So thank you. I really enjoyed the presentation, and this is a very opioid overuse is a very big global issue, health issue, and and I like the fact that you guys talked about where there have been, after some assessments, that have been grouped into people that will fall into the red zone, and then the yellow zone that will now be moved into another type of program. Then these people will move into another type of program. That's a very excellent idea. And I would love to know how the coursework would attend to the various people that will be in the program, the various levels of change that you will be seeing. Like there might be people that will be in the contemplation stage. There are people that will be in the pre-contemplation stage. There are people that will be in the action stage. How do your coursework attend to those various set of people in the program.
So just to summarize, the question that Dubem is asking the group is, what is your theory of change? And a predominant theory of change that is used in drug, in alcohol, and in smoking cessation programs is the TTM, the Trans Theoretical Model. And that means that according to that model, it says that individuals who are addicted to substances come at different stages, and you can have interventions to target them at those stages. So I think what he was trying to find out, I think related to Jada's question, is if you were doing your benefit cost analysis, can you quantify the benefit of moving somebody from a contemplation to pre-contemplation and then across the continuum to change? Can you quantify that? And if so, how?
That is a very interesting question. To be honest, we as a team, we didn't actually think about that, and it's actually good to have different perspective and fresh eyes to kind of inform I guess that component, and that is something that we could think about going forward, to add, like maybe look at the different stages that the participants are at and probably add it to the program. But thanks for that question.
Fantastic. That's good. I have another question online here from Beverly. Beverly is asking you, do you think that adding a virtual component to this program will reduce stigmatization, especially among young adults?
We have anticipated that that would be one of the barrier in our program, the possible stigma towards individuals with substance use disorder due to stereotyping and discrimination. However, we anticipate that the introductory workshop and the subsequent health literacy will mitigate this barrier. And through the use of the CHAMPS app, as mentioned earlier, it would be a safe space within the app network wherein these people will be able to share on their progress, share on their journey, and will be comfortable in sharing what they're going through.
Thank you so much. I think, again, this is another terrific program proposing to address a real life problem in our communities. Canada, Toronto is the location for this one, but I'm telling you, the problem is global. Here in the States, here in Prince George's County, we know this is a major problem. But I want to thank everyone for joining us this afternoon, for your time, for your expertise. And once again, join me in congratulating all our fellows. I think Brown has a parting music for us to conclude. Please complete all your evaluations. Don't be a stranger. Feel free to reach out, and you're going to get all your certificates, 1 week or 2 weeks after. And then for those using it for coursework, I think we have completed every work. But again, thank you so much. God bless you. You guys go on and make a change and transform lives. Thank you so much. Bye-bye. Brown, your music.
Dawo yami ayikholana, buso wami awukholana, ilondoloze zuhambe nami. ayikholana buso wami awukholana ilondoloze zuhambe nami Jerusalema ikhaya lami ilondoloze uhambe nami zungangishilana Jerusalema ikhaya lami ilondoloze uhambe nami zungangishilana dawo yami ayikholana buso wami awukholana ilondoloze zuhambe nami Jerusalema ikhaya lami ilondoloze uhambe nami
Thank you so much. So it will be sad to miss you guys, but you know, we are here. Feel free to reach out. Feel free to ask questions. We hope this is going to be a long-term professional relationship. We're trying to create a Google work group because I think people have asked for that so that we can share more resources. We got a feedback about R, and so the new cohort started today. And one of the things we're going to do is that we are going to add R, at least an introduction to R, and we're going to send out information so that if there is any of you who are available, who want to join, you should be able to join free. I think we're beginning to understand that R, an open access platform, data analysis is a key component. We're going to do more work on systematic review. Actually, we have a librarian, an international librarian in the cohort that started today, and he thinks that that is a core aspect of what we should add here. So please be our ambassadors. If you know people who want to improve their skills, if you have feedback for us to improve the program, feel free to send them to me. If you want to meet, if you're interested in considering a career in the federal government, in the US federal government, reach out to Susan. We are happy to provide opportunities for navigation. You know, of course, you know, if you need a reference letter, if you want to go to grad school, if you want to go back to school, if you need a recommendation, I do really like talking to people. So I can talk to people, and, you know, my accent makes me unique and, you know, makes me trusting as well. And so I have used that accent in several ways to get people get positions where in the US here, in Canada, in Netherlands, in Europe, and so forth. So please, the next question is, if anybody is interested in implementing our program, of course, we're going to reach out to the group, and to the best of your ability, we're going to want to use you guys as the core place of the work. You know, you've heard from Marissa. if you are here in the States, you want to reach out to her, I'm happy to make the introduction. There are other people too, just to make sure that we continue. You become an important alumnus of this program, and each of you matter. Wherever you are, we'll continue to be part of your careers, and I hope you'll continue to be part of GHEP as well. Does anybody want to say anything before we call it a day?
I just want to add thank you for all the support that you've provided the group. We really appreciate your feedback and directness and your honesty and your humor. It was helpful to navigate this sometimes difficult transition, but educational nonetheless. And I've learned so much, and I thank all of you for the support.
You're welcome. I hope I wasn't that really bad, but it comes
Never.
with it. Yes. Any other comments? Any other thoughts? Otherwise, bidding you wonderful farewell. You guys are gonna do great things. It's not me now giving you feedback about the project. You've had people in public health, people who lead cities, telling you that these are really well thought out programs. So congratulations once again, and thank you for inviting your family. Enjoy. God bless you guys for giving us the opportunity to serve and to be part of your professional development.